Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer online therapy via Skype for anxiety and depression and many other emotional problems. One of the requests that I get quite frequently is for help in overcoming driving phobia, a fear of driving, especially on highways and freeways. So if you're looking for online treatment for driving phobia and you would like help in getting over fear of driving, then you might want to consider the online therapy program that I teach. So I'll teach you how to overcome your fear of driving in a very structured way using the techniques of Mindfulness-based Exposure Therapy. This is a system of work that I have been working on now for several years and that people find very effective for overcoming all kinds of anxiety, especially anxiety that involves panic attacks or fear of panic attacks, such as driving anxiety. So the key to overcoming fear of driving is not to avoid driving, but rather learn how to design exposure challenges. We need to take on the anxiety in order to heal it, to overcome it, but we must do it in a very structured way. So you design yourself a series of exposure challenges. That's the first step. Usually challenges of increasing difficulty. So you make a list of those challenges. Even if it's as simple as driving to the beginning of a bridge or a on-ramp to a motorway or a highway. It doesn't matter what the severity of the anxiety is, but the thing is to construct a well formatted series of challenges that you can work through effectively on a daily basis, doing a challenge each day until you have completely mastered the challenge and developed complete confidence and complete absence of anxiety in that particular challenge. So start with a simple challenge first of all to get to that place where you know that you feel completely confident doing that challenge. Then you move on to the next challenge on your list. So the secret to make this work, to really get over driving anxiety in an effective way, is to train before you do each of those challenges. So just doing the challenge over and over again is not enough. That is a typical approach in classical exposure therapy, but it's not very efficient, and you do run the risk of re-traumatizing yourself and increasing that anxiety. So what I've found to be much more effective is if you do mindfulness training some time before you actually do the challenge. It could be half an hour before doing the challenge. But the thing to do is to do that mindfulness training with the anxiety to neutralize it. Then you do the challenge. And that way the challenge will be more likely to be effective, and you'll be more likely to do it and with no anxiety, and that will have a very strong reinforcing effect on your program for overcoming your driving anxiety. So the training involves learning how to meditate on your anxiety. So we use meditation as a tool not to relax the mind, no, but rather to meditate on that anxiety reaction itself. So we play through the scene of the exposure challenge that we're about to do. We look for the anxiety that gets triggered, and then we work with it using mindfulness to neutralize it. Now, the first step in training with that anxiety reaction is to overcome the blind habit of becoming anxious. So this is called reactive identification, and that is the primary problem. So the anxiety gets triggered and then we become anxious. What we want to do in our training before doing the exposure challenge is to see that anxiety and then establish a non-reactive relationship with it, where we do not identify with that anxiety. So we see the anxiety as an object in the mind, instead of becoming the anxiety. So this is a very important part of mindfulness training, is developing what we call objective consciousness, where you can see the emotion without becoming the emotion. That is critical in the change process. So we train that way. We play the scene through in the mind in order to trigger anxiety, but now when we see that anxiety, we develop conscious awareness of it as an object, rather like putting it on a screen, which is really what anxiety and other emotions is. In essence, they are objects that get triggered through conditioning and arise in the mind, and stay there for a while, and then they subside. So that's how you define a mental object. The trouble is that we think we are that mental object. We become identified with that anxiety. And that causes what we call reactive emotional contraction. And that's what it feels like for most people when they're struggling with a severe anxiety reaction associated with driving phobia. It feels very much like the walls are closing in. Our body will tighten up, it will contract. We feel very small. So all of these characteristics are what typically are experienced when we have an anxiety attack. And that anxiety attack is primarily caused by reactive identification. So you can train out of that habit by playing it through in the mind and establishing conscious awareness, mindfulness of that anxiety as an object. You can sit with your anxiety and not become anxious. So that's really quite important. You can then work with that anxiety in various ways to help it heal faster. So our objective is to heal that anxiety that, as we imagine it arising. And there are various techniques. The first is this very process of developing objective consciousness, because that stops feeding that anxiety. The second part of our mindfulness training, our preparation before doing the challenge, is to help it heal. And this is technically called the response of compassion, which is a big part of mindfulness training. So we're learning to respond to the anxiety with compassion, in very much the same way that you might respond to a child that was in pain. You know how to respond skillfully to a child in pain. You know how to do that already. It's a natural property of your true self. So you learn how to bring compassion to bear on that emotion. You treat it in the same way as you would a child. You can work with its imagery too, which is a very effective way of increasing that objective consciousness and also increasing the effectiveness of your interaction with it. So a classic thing that we do with driving anxiety is to make the anxiety smaller. So once you've identified the anxiety as an object, you can change its imagery. You can make it smaller. That imagery is a very, very big part of the structure of the anxiety. It has to be very large in order to overwhelm you, in order to be intense. That's a function of the size of the emotional imagery. So we can change that size. We can make it smaller once we establish a conscious, objective relationship with it. So making it smaller is how the anxiety subsides. So this is part of that response of compassion. You are technically helping the anxiety resolve itself. There are lots of other ways we can interact with it. Certainly the whole idea of making friends with your anxiety as an object, like a child that you can make friends with, that will have a very profound effect on helping that anxiety resolve itself. So there's a whole variety of ways that we can interact consciously, mindfully with that anxiety to help it resolve itself, to heal. So this is part of the training that we do before we do the exposure challenge. We train with it until that anxiety has healed and has been neutralized. Then we do the challenge, and that simply puts our training into practice, and we start to experience the exposure challenge quite differently than before, because we have trained with it. And you'll find that it's much less able to produce anxiety once you've trained with it ahead of time. And then you work with it some more, doing the same thing, developing a mindfulness relationship with that anxiety, helping it heal more. And so you're strengthening those natural healing pathways in the brain. And eventually that training becomes automatic, and then the anxiety no longer arises in the presence of those triggers, whether it be crossing a bridge or entering a busy freeway. So this is a part of what I'll be teaching you during our Skype therapy sessions together. If you would like help overcoming your driving anxiety using mindfulness therapy, and you'd like help in constructing that series of incremental exposure challenges, and you'd like help with those, then please contact me. This approach works extremely well, and most people see tremendous benefits after a few sessions. Recently I worked with a lady who had severe driving anxiety, and all she wanted to do was to be able to get in her car and drive to the nearest coffee shop. That was tremendously important for her. But she couldn't do it because of her driving phobia. So I worked with her online through Skype for 2 to 3 weeks, and by the third session she was able to take that drive with me online using her smartphone to that coffee shop. So it can be done. It's not that difficult to overcome driving anxiety and the general fear of driving. You just have to approach it in the right way. So if you'd like help with overcoming your driving anxiety, then simply email me through my website. Go to the contact page, tell me more about yourself, and then let's schedule a Skype therapy session and we can get started on your recovery from your fear of driving. Thank you.